Good morning, everyone. My name is Nazim Muhajirin, and I'm joining you from Sri Lanka this morning. First off, I'd like to thank the organizers of this event, and particularly Jasmine, for inviting me to kick off the colloquium today, the discussions, and I hope that some of the thoughts, data that we are offering today will inform and will provoke some good discussions later this morning and into the afternoon. So let's begin. In addition to the land acknowledgement words that I have here on my slide, I'd like to share a few more things by way of introduction. Though I am from Sri Lanka, born and raised there, culturally I am Malay, a very small minority group in Sri Lanka. I speak 3 languages, Malay being my mother tongue. My first degree was in neuroscience from Oberlin College, Ohio. My master's in epidemiology and biostatistics from the University of Massachusetts in Amherst, and PhD in social epidemiology from University of Saskatchewan with courses taken from Boston. I did a postdoc fellowship with Canadian Institute for Advanced Research, a think tank, and was appointed to the faculty in community health and epidemiology in 1997 in College of Medicine. We reached another anniversary last Friday, March 11th, 2022, 2 years of COVID-19 pandemic in this world. The World Health Organization declared COVID-19 a pandemic on March 11th, 2020. Since then, nearly 3.4 million Canadians have been stricken with COVID-19 and almost 40,000 have lost their lives in Canada. In Saskatchewan, in our own province, over 123,000 people have been stricken with COVID and over 1,000 people have lost their lives. Epidemiologists and biostatisticians and even modelers who crunch the numbers and who track pandemics and keep an eye on the numbers believe that these numbers are an underestimation. Understanding the extent to which it is an underestimated, for example, in Saskatchewan, is what we are intensely working on currently, one of the projects we are working on. The Canadian economy has not been spared. It has been racked by shutdowns and unemployment. Not only were millions of Canadians laid off without income, and millions more had their salaries cut either directly or through reduced working hours. I remember the first week of the pandemic in Saskatchewan quite vividly. March 11th, 2020 was a Wednesday, and that morning I wrote a mass email to all of our graduate students in the program and to my colleagues about the WHO declaration of the COVID-19 and what this meant for us in the early days of the pandemic and what we needed to do to keep ourselves and others around us safe. March 12th, a Thursday, we heard that Saskatchewan had its first 2 presumed positive cases. That day, the Junos was cancelled, which was scheduled for the Sunday. Then March 13th, Friday, universities suspending their classes, and next Monday, March 16th, all schools suspending learning and teaching in person as of the weekend, that was March 20th, until further notice. These were unprecedented series of emergency events. These types of actions weren't taken only in Saskatchewan, but throughout Canada. We hadn't seen anything like it for generations. We have a lot of media that reports how the COVID-19 pandemic has comprehensively disrupted our lives. A lot of this data comes from elsewhere outside of Saskatchewan. While some of these data are generalizable to our province, but not all are. We need our own data to understand our own situation. And from analysis of these data, we need to figure out what needs to happen in this province as we move forward from this pandemic. This is the motivation for our many COVID studies we have undertaken in Saskatchewan since the beginning of the pandemic in March 2020. We have conducted studies starting early in the pandemic to understand people's behavior, risks and protection, perceptions, and vaccines throughout the first 15 months of the pandemic. This is our social contours and COVID-19 study. Partway into the first year, we teamed up with Mental Health Research Canada to undertake several studies focused on mental health and COVID-19 in Saskatchewan, both in children and youth and in adults. Given the theme of this partnership event and the audience I'm addressing, I have chosen to focus on one study on mental health in adults in Saskatchewan during COVID. Within this paper, our focus is on how mental health in particular continues to exact a toll on immigrant residents in Saskatchewan and on visible minorities, by which we mean Indigenous and persons of color. So let's dive into this study. In this study, we partnered with Mental Health Research Canada, as I mentioned, or MHRC from here on, a funder of mental health research and a champion for advancing evidence-informed mental health-friendly policies and programs throughout Canada. Starting in April 2020, MHRC has been surveying about 2,500 Canadians every 6 to 8 weeks. They're just wrapping up their 12th cycle of data collection. We had them collect extra samples of respondents in Saskatchewan, almost 600 compared to the usual 125 or so respondents that they collect. We did this in August 2020, again in February 2021, June 2021, November 2021, and also just this past month in February 2022. When we have completed the longitudinal panel of data, we will have 5 data cycles of about 575 Saskatchewan respondents each in each cycle, telling us about their experiences in relation to mental health during the first 2 years of COVID-19 in Saskatchewan. The data, however, I'm sharing today are based on the first 3 of these cycles. Again, August 2020, February 2021, and June 2021. In this slide, we see the COVID-19 case rates for both adults, for all ages, and for youth, children and youth 0 to 19. And we have marked some milestones in terms of reopening stages, vaccine rollout commencement, and also the dates you see in red below the x-axis are the 3 dates on which we collect data and are reporting today. So let's just pause and remember where we were as a province in the pandemic. August 2020, our case rate and hospitalizations were at one of the lowest. February 2021, this is at the near height of the second wave here in Saskatchewan. It was the Alpha variant driven wave, which started right after the Christmas and year-end holidays in 2020 and continued, peaking in January 2021 and beginning to decline in late February. So our survey was taken in beginning of February 2021 in that Alpha wave. In June 2021, we were getting a lot of first doses of vaccines to people, and we were getting ready to reopen Saskatchewan for the second time. The case rates were relatively low, and the hospitalizations were as well. It needed to be said, though, that this is also the beginning of our second summer, full summer of COVID-19 in the province. The next 2 slides are really to help you understand the nature of the samples of Saskatchewan respondents across the 3 survey cycles. In a nutshell, the samples we have a very good representation of Saskatchewan adult population. The samples were similar to the Saskatchewan adults in terms of age and gender, employment status, highest education level reached, immigrant status, visible minority, and disability status. In other words, equity-seeking groups. We show the breakdown for equity-seeking groups in the next slide. So you see in this slide, in terms of immigration status, roughly about 1 in 4 respondents were born outside of Canada. In terms of ethnicity, about 17% in June indicated that they were a member of an Indigenous or visible minority group. And in terms of physical disability, in June again, about 6% of people said that they live with some kind of a physical limitation or physical disability. Here we have the first set of results. We are looking at how many people reported anxiety or depression since the outbreak of COVID-19 in March 2020. Panel on the top are results on anxiety, and panel on the bottom, results on depression. These were measured using validated research tools. The three colors represent the level of anxiety or depression. So blue is low, orange is moderate, and red is high or severe. What you see is this. One, a substantial proportion of respondents, about 60% for anxiety or 45% for depression, reported moderate to severe anxiety or depression. Two, there were more who said that they were experiencing severe anxiety or depression in the height of the second wave. So that would have been in February 2021 compared to the other two cycles. These numbers are comparable to numbers overall from other provinces and territories, and also with Canada's averages. There are a lot of data presented here in this slide, so let me break it down a bit and summarize the data. I would like to skip the top two panels for a minute and first focus on the bottom three panels. In each panel, proportions of respondents who report moderate and severe depression are presented in each horizontal bar. Dark gray shows the percentage of moderate depression, and orange part of that horizontal bar shows percentage of people who report severe depression. Each long bar represents a category in an equity-seeking variable. So for example, visible minority versus white, which is shown on the bottom left panel, and so on. The longer the bar, the more people with moderate or severe depression. These bars are repeated for each data cycle, and these cycles are labeled on the left-hand side just next to the y-axis. We see that for each equity-seeking variable, those who are visible minority, those who are born outside of Canada, and those with physical disability have higher percentage who say they have experienced severe depression. I'll give you an example. In the bottom left panel, those who said they're visible minority have higher percentage who experience severe depression compared to those who said that they are white and experiencing severe depression. So the percentages are 25% compared to for visible minority, Indigenous, compared to 18% for people who said they are white. This is for data for February 2021. Similar to the previous slide, three panels in the bottom present moderate and severe anxiety by each equity-seeking variable in this slide. The results are slightly different from anxiety compared to the results for depression. What is quite noteworthy is the almost doubling of percentage who said they're experiencing severe anxiety between those who were born in Canada versus born outside. This is for June 2021 cycle. You see almost twice the percentage who said that they experience severe anxiety, 39% born outside of Canada versus 19% born in Canada in June 2021. This difference between the two groups is quite consistent across all three cycles, but for the other two cycles, the differences are not as prominent as it is for June 2021. Makes you wonder whether the cumulative effect that has taken now almost into year and a half into the pandemic and taking a toll on some people compared to others. There's quite a disparity in the percentage of those who experience severe anxiety from those with and without physical disabilities. And the data here are presented in the bottom series of data panel, but right to the right end of the panel there. The two panels you see on the top are what we know more about. That is, people who were hit the hardest by the pandemic were those who were least able to muster the resources to cope with it. In other words, those who were unemployed, either before or because of the pandemic, and those with low income. We understand this phenomenon very well in health. We call it social determinants of health. But what happens when we bring what we see in the panels above on this slide with those findings we see in the panels below on the bottom portion of this slide? In other words, what is the double jeopardy or double whammy, so to speak, when we bring the effects of that, when we bring the socioeconomic and cultural aspects together? How does that work in terms of mental health outcomes? Some answers to this question is what we see here in these two plots. I know for those who don't look at these types of plots every day, it is a bit hard to understand, so let me help you with this. What these plots show are answers to the question, like I said, do immigrant status either worsen or mitigate the relationship between income or education levels and moderate or severe anxiety? Put another way, do immigrant groups differ or suffer more, really, or less compared to their Canadian-born counterparts in, in their experiencing negative mental health outcomes? What the plots are showing is that, yes, those who are born outside of Canada, shown here in the dashed lines, are more likely to experience moderate or severe anxiety compared to those born in Canada, if their income level is low or education is low in particular. In the plot on the left, you see the dashed line dropping as income increases, which is shown in the x-axis from left to right, meaning less probability of moderate anxiety. That is the line for those born outside of Canada. Same pattern is not seen for those born in Canada. So these two plots represent the outcome moderate and severe depression. Again, they answer the question, are immigrants and those who are visible minorities likely to experience more negative mental health outcomes, depression here, compared to their Canadian-born and white counterparts? Again, the answer is yes. As shown in the left panel, those born outside of Canada and had an elementary level education are more likely to experience moderate depression compared to their Canadian-born counterparts at the same level of education. On the right panel, data show that those who are Indigenous or visible minority and older, greater than 30 years of age, were more likely to experience severe depression compared to their white counterparts. In fact, for those who declare themselves as white, The older they are, the less likely to experience severe depression. So this slide summarizes the key takeaways from our study. In summary, we have 3 or 4 points to make. Point 1, age, gender, income, and education strongly shapes the way people in Saskatchewan had experienced mental health during the COVID-19 pandemic. Women more than men, younger folks more than older, those with lower income, those whose levels of education were not as high, suffered more in terms of moderate and severe anxiety and depression. Point 2, these relationships furthermore were exacerbated or made worse for specific equity-seeking groups, by which we mean those born outside of Canada, Indigenous and visible minority groups, and those living with disabilities as well. Point 3, this negative mental health experience were more common, or in other words, more people experienced it during the pandemic than they did before the pandemic. Point 4, the last point, many people, in fact 1 in 8 in Saskatchewan who needed services for mental health reported not receiving those services in time. We have not shown those data right now in the interest of time. So let's switch to some data that our partner Mental Health Research Canada has recently produced on workplace psychological health and safety. This report, titled, as I said, Psychological Health and Safety in Canadian Workplaces, is very germane to the discussion of this partnership event. We have mentioned the authors of this report on our slide there, and we repeat that in one of the last slides. I will share with you some relevant key findings for your discussion today. First, though, a quick recap on how they define psychological health and safety. Questions relate to 12 areas of workplace domains or indicators were measured. They are listed on this slide in the middle. And then they also measured the 13th indicator on its own, and this was on burnout. So here are the key findings on this slide. I'm not necessarily going to go through all of this point by point, but let me just, in the interest of time, underscore a few of the findings in this report. The first thing, and this wouldn't surprise you at all, that workers and people who work in the healthcare sector are more likely to say those psychological health and safety attributes are rare in their workplace and are more likely to experience burnout, traumas, discrimination, harassment, and to be treated unfairly due to mental health. Transportation sector did not fare very well in people who work in the transportation sector. These people felt the least positive of all sectors across all psychological health and safety measures. While managers generally feel more positively about workplace health factors, they have a high rate of burnout as well. Again, a staggering 48%, almost 1 in 2 first responders indicated there were unavoidable psychological harm in their workplace. Those working in education are more likely than any other profession to say they enjoy their work, 66%. And those work in healthcare, 57%, and education, 62% say their work is an important part of who they are. And this doesn't really surprise me. I think even during a pandemic, people, educators, people working in the education sector, people who are looking after others in the healthcare sector, really look at their work as a personal calling almost. While those who are not in the management positions feel just as likely to give extra effort, they feel less engagement on all other factors. 3 in 4 employees had new COVID-19 policies in their workplace. But when we asked what these policies were, only 4% mentioned that mental health policies, were part of them. And this last point, those in healthcare are least likely to experience clear communication, support from their superiors, and effective response to difficult situations. They also feel unprotected in cases of physical safety concerns. Now, some data on the burnout specifically. This study found that 35%, or 1 in 3 Canadians who responded to this survey, are feeling burnout at work. Burnout was highest among young women and was particularly common among visible minorities, members of the LGBTQ2S+ community. Of the workplace sectors, burnout was highest, 53%, or 1 out of 2, and again, not surprisingly, in the health professions, particularly among nurses and mental health providers. Here we have a situation that the helpers themselves needing help. This table shows the category of respondents where there were significant differences compared to the other categories. So the categories in red, for example, on young age groups, 18 to 34, 35 to 54, compared to old age group, had experienced significantly higher burnout. And those categories, people in the categories colored in green, experienced significantly lower burnout. And I'm not going to spend too much time there because I think in the previous slide, when I talked to it, I think I mentioned some of the highlights that are shown in a different way on burnout outcome, in this slide. We have understood Saskatchewan and Canada-wide data that the pandemic was not an equal opportunity disruptor of our lives these past 2 years. At the beginning of the pandemic, as we heard stories that some of the celebrities and jet setters of the world were hit by COVID, some began to say that this coronavirus doesn't discriminate. It would infect you even if you happen to be one of the highest paid celebrity actors, as well as those whose position are quite the opposite. But now we know differently. In fact, we know better. This pandemic has significantly affected everyone's lives, but it has been devastating for some more than others. And this some have been those who had already been least able to afford disruption and threats in their lives. Who are they? Essential workers, service workers, temporary or seasonal workers, culturally marginalized groups, those who are trying to build a life in a new culture, historically marginalized groups, younger people, women, and those with physical and other types of limitations. What can we do? In fact, no, what do we need to do to build back better? As Churchill once said, and I paraphrase, let's not let any crisis go to waste. Let's learn, let us resolve, and let us build things back much better than it was before the crisis. This is what you'll be discussing, or at least the backdrop to your discussion and conversations today. Here are some food for thought as you think more deeply, more expansively, and more practically about these matters. Some things that government should consider as they plan how to rebuild, courtesy of a friend's Future Skills Center out of Ottawa. Investing in childcare, career assistance, training, reskilling, and mental health services for immigrant women. I'm not going to go through, again, all of this list of things that we should be doing, we could be doing, need to be doing, but let me just sort of say that this last point, engage all levels of government and businesses, post-secondary institutions, employers, regulators, and the civil society to chart an inclusive pathway forward. And in that same report by Future Skills Center, they have 3 points in their calls to action. And these 3 points are worth mentioning again as a closing. First, develop a national strategy, and boy, do we need one right now coming out of COVID-19, to enhance immigrant labor market inclusion. This includes the reskilling, retraining, and recognizing justly, the education, the professional training people have had when they come to Canada to settle. Establish policies and programs to mitigate negative impacts of pandemic on immigrant and migrant groups and those who are a visible minority and those with physical limitations and disabilities. Develop innovative tools for an immigrant inclusive post-pandemic economic rebuild for Canada. These are some links to our ongoing studies on COVID-19. I think we are doing about half a dozen COVID-19 studies. The latest being Build Back Better project. That is our affectionate name for the project that we've just been funded by Canadian Institutes of Health Research. And in this project, we hope to really look at, how pandemic has impacted people in Saskatchewan in mental health, substance use, housing precarity, food insecurity sectors, and really understand what we need to do in building back better. I invite you to visit this website where you can find more information about our projects. Last but not least, I want to recognize various people in our teams who have contributed to this work. Without their diligence, without their smarts, without their commitment, we would not be sitting here sharing this information with you. So I tip my hat to each and every member of my team. And again, I thank you very much for inviting me, and I wish you a very good morning and very fruitful and productive discussions today. Thank you.